Hi, everyone. I'm Dr. Tardival, and I'm the Program Director for the Traditional Baccalaureate Program here at LSU Health New Orleans School of Nursing. And I am doing a webinar so that way you can learn more information about the School of Nursing and how to get into the School of Nursing and be successful. So first of all, I'd like to introduce you to the Health Science Center webpage. Here at the Health Science Center, we have 6 schools: allied health professions, dentistry, graduate studies, medicine, nursing, and public health. Our school of nursing is different from other schools of nursing in that we are located in a health science center. We're the only school of nursing in the state of Louisiana that is located within a health science center. So what does that mean? Being a school of nursing in a health science center, we have what's called interprofessional education. So as a nursing student, you're going to have classes with students from allied health, dentistry, medicine, and you learn their role and they learn your role. And then you discuss patients and what's the nursing perspective versus the medicine perspective versus the allied health perspective. And because of interprofessional education, you learn to collaborate and communicate more efficiently and will have better patient outcomes. So we're excited to be able to offer interprofessional education here at the Health Science Center. So let me take you to the School of Nursing webpage. And here you go. Here is our webpage and some things I'd like to share with you, first of all. I would definitely ask you to read our magazine, Nursing LSU Health New Orleans, right here at the top. Click on the magazine and check us out. You'll see what's going on here at the School of Nursing, what our faculty are doing, what our students are doing. It's stories about life here at the School of Nursing. So definitely check out the magazine and learn about us. I would also like to mention that we are a top 8 school of nursing. So they rank schools of nursing based on NCLEX pass rates, number of programs, activities, and LSU was number 8 in the United States. So that's a pretty awesome accomplishment. We were also the 5th best nursing school of public universities, okay, in the United States. And we were the 2nd best nursing school in the Southeast region, only behind Duke. So we are a strong school of nursing. We put out a quality product, and the nurse executives want our students. I would also like to introduce you to Dr. Porsche. He's the dean of the School of Nursing. He has been the dean since right after Hurricane Katrina, and under his leadership and direction, the School of Nursing has grown in so many ways, and I'll show you that in the next few minutes. I would also like to mention that we are the first nationally accredited nursing simulation center in Louisiana. So our simulation lab is accredited, which is an important step to have that done. So we're very proud of that fact that we were the first school in Louisiana to have an accredited simulation center. I would also encourage you to watch this video, LSU Health Nursing Works. Once again, it's a video where they introduce students and faculty, and they talk about their life here at the School of Nursing. So definitely check out that video also. You really want to learn about the School of Nursing, read the magazine and watch the video to see who we are. Please follow us on social media, whether it's Twitter, Facebook, Instagram. Our nurse recruiter, Ms. Suad, she's constantly posting things about what's going on at the School of Nursing, what the students are doing, what the faculty are doing. So once again, it's a good way to stay in touch with the School of Nursing and what we're doing and what we are about. So definitely check us out. All right, so let's go to the prospective students page. Some information here would definitely ask you to check out would be financial aid, tuition and fees, student housing. Definitely click on those links if you have any questions. There's contact numbers there that you can call someone and speak to if you have further questions. But definitely check out the fees, the financial aid, and the student housing. We have also included here a roadmap. And these are common schools that we get applicants from here at LSU. So once again, you'll see here are the 37 hours of prerequisite coursework right here, okay? Then if you scroll down, and let's say you go to Dillard. Well, here are the courses that we accept from Dillard. Or if you go to Southeastern, here are the courses we accept from Southeastern. So definitely use the roadmap to make sure you're taking the right courses. And of course, if you have any questions, feel free to reach out to me. All right, so let's go back to the academic programs that we have here at the School of Nursing. And this is where we've grown a lot in the last 13 years. We have 3 undergraduate programs: the traditional Bachelor of Science in Nursing program, the CARE program, and the RN to BSN program. This informational session is strictly for the traditional Bachelor of Science in Nursing applicants. We also have many graduate programs. As you can see, we have 2 Master of Science in Nursing programs, the Clinical Nurse Leader and the Nurse Educator. But then we have all these Doctorate of Nursing Practice programs, including anesthesia, CNS, nurse practitioner. But then look under nurse practitioner. We have many different specialties, from pediatric primary care to psych mental health to neonatal to adult gero acute care, adult gero primary care. So we have many different NP tracks, and we're hoping that you want to come back to school and be that advanced practice nurse, whether it's nurse anesthesia, nurse practitioner, or CNS. And we also have the research-based doctorate, which is the DNS, the Doctor of Nursing Science, which we have recently just received approval to convert it to a PhD program. So as you can see here, we have 3 undergraduate programs and then many graduate programs. Let's go to the traditional Bachelor of Science in Nursing. Here is my information right here. If you ever need to get in touch with me, you can email me. You can also just click the Ask the Traditional BSN Director, and it'll come directly to me, and you can also send your transcripts in to be reviewed by me. So let's look at the admission criteria. Here at the School of Nursing, we look at 4 things to get you into the School of Nursing. We look at GPA, we look at HEIS score, we look at your interview, and we look at your proctored essay score. So let's look at the GPA first. All applicants must complete 37 hours of prerequisite courses. Of those 37 hours, 16 hours have to be completed by the time you apply. Okay, so if you look below here, algebra, English 1, general biology lab, and theory, chemistry, and general psych. These 5 classes, or 16 hours, must be completed by the application deadline. So here at the School of Nursing, we have 2 application deadlines. We have an August 1st deadline, students who begin school here in January. And then we also have a January deadline for students who begin school here in August. So if you're applying in January, you have to have these 16 hours completed. Okay, the algebra, the English, the biology, the chemistry, and the psychology. There are no exceptions to that. Those 16 hours have to be completed by the time of the application. We do require a B or higher in the science courses. For the biology, theory, and lab, and chemistry, you have to have a B or higher in order to be an eligible applicant. And you must have a GPA of a 3.0 on a 4.0 scale in order to be eligible for admission. So the GPA is one of the first things that we look at. Okay, the 16 hours must be completed by the time of admission. You have to have a 3.0 GPA, and you have to have a B or higher in your science courses. Okay. Now, students ask all the time, what happens if I retake a course? Well, if you retake a course, we're going to accept the higher grade. So if you got a C in algebra and you came back and retook it and got an A, we're going to pull the A. Also, students receive credit, pass credit or AP credit. We'll take up to 9 hours of credit. Now, on your transcript, credit's going to show as a P. So if you have credit for algebra, it's going to show up as a P. And if you have credit for English, it's going to show up as a P. What does that mean? That means if you have A's in biology, lab, theory, chemistry, and psychology, then your GPA is a 4.0. On the other hand, if you have credit in algebra and English, and you have B's in those courses, then your GPA is a 3.0. Okay, so be careful with that credit, because it can help you or hurt you depending on how you do in the remaining courses. But those 16 hours have to be completed at the time of application. Here is all 37 hours that have to be done by the time you begin classes here at the School of Nursing. some students may have completed more than 16 hours when they apply, but we're only going to pull the 16-hour GPA from those hours. So even though you may have completed 27 hours of coursework, we're only going to look at those 16 hours when we're looking at your GPA to get you into the School of Nursing. That way, everyone is compared the same way with those 16 hours. But these 37 hours must be completed by the time you begin classes here. You must have a 3.0 GPA on these 37 hours, and you must have a B or higher in that microbiology because it is a science course, okay? So 37 hours are listed right here, a B or higher in the science courses, and an overall GPA of 3.0. The next thing that we're going to look at is your HEIS, okay? The HEIS is a standardized assessment that tests you basically on those 16 hours of algebra, English, chemistry, biology, okay? The HEIS can be taken twice within an application period. So if you're applying in January, the application period begins August the 2nd and goes to January the 14th. During that time, you can take the HEIS twice, okay? But you have to wait 6 weeks in between test dates, and you must receive an 80 or higher on the HEIS. Right here, we have some HEIS FAQs, frequently asked questions. Oh, not there, sorry. Stop share. Give me a second. So right here is how you sign up for the HEIS. First of all, we don't administer the HEIS, so you're going to have to go through HEIS. So once again, you can click here, you can create an account through Elsevier and sign up to take the exam. The thing with HEIS is that they do not post exam dates until the end of the month. So at the end of September, they'll post October dates. At the end of October, they're going to place November dates. Okay, so just know that. We have a code here, 198306. If you use our code, we automatically get your scores. Okay, there's nothing else you have to do. Here I have the HEIS FAQs. We have some review videos right here for you to watch. There's some practice questions here. There's also a study guide that Elsevier puts out that I would recommend you using also. We talk about the importance of the HEIS. Here are the sections that we're going to test on, okay? And more importantly, the exam must be taken by the application deadline, okay? And also with the HEIS, you have to have a score of 80 or above. So to review, the HEIS, you have to have an 80 or above. You can take it twice within an application period, and you must wait 6 weeks in between test dates if you have to take it again, okay? And then also click on the HEIS FAQs to see more about that. So when you apply, if you have a GPA of 3.0 or higher, a B or higher in the science courses, and a HEIS score of 80 or higher, you are an eligible applicant, okay? Then you will continue on with the application process, which means that you will be invited to do the written statement paper and the interview. If your GPA is less than 3.0, or you have a C in biology, or less than an 80 on the HEIS, then you are an ineligible applicant. You will no longer be eligible, and you will not qualify for the interview or the written statement paper. The written statement paper is a proctored essay, okay, that we administer typically here on campus, but with COVID, we're doing it remotely right now. But with the written statement paper, you have 30 minutes to write 4 paragraphs. We're looking for an opening paragraph, a body of 2 paragraphs, and then a concluding paragraph. And it's on a topic that has really nothing to do with nursing. There is no right or wrong answer. We're just seeing if you can put together 4 paragraphs that make sense. There's lots of writing in nursing, okay? Every semester you have formal papers to write, care plans to write, and you have to use APA, and you have to be able to write. And not to mention that we're hoping that you want to come back to graduate school here and become that advanced practice nurse, which is a doctoral degree. And there's lots of writing when you're getting your doctoral degree. And then the final component is the interview. The interview is online, but it's not live time. So you'll get the interview questions from Ms. Gravelet in the Office of Student Affairs. You'll see the questions, you can practice them. And then when you're ready to record, you can record them from your phone, your tablet, your computer, however you want, okay? If you like the questions, if you like your answers, okay, then you're good to go. But if you don't like your answers, you can always record your answers up to 2 times, okay? So we're looking for some really quality answers since we're giving you the questions. So you have 3 minutes to answer each question. I would definitely take about 3 minutes to answer the questions. Don't give us an answer that's 10 seconds long. We want some depth to your answers, especially since we're giving you the questions in advance. So those are the 4 admission criteria that we look at: the GPA, the HEIS, the written statement paper, and the interview. You're given scores, and then you're ranked, and then that's how the students are admitted to the School of Nursing. So let me go now into the curriculum. For the first semester here at the School of Nursing, you'll be taking human physiology, anatomy, intro to professional nursing, health assessment theory, and lab, okay? So these are the courses you'll take the first semester, 13 total hours. It's all didactic, meaning there is no clinical component. You're not going into the hospitals yet. You're learning about physiology, you're learning about anatomy, you're learning about health assessment theory. You go into the lab and you're practicing your health assessment skills. Where do I listen for breath sounds? How do I listen to heart tone? And so forth, okay? It's all pretty much didactic. I will tell you that the physiology and anatomy is taught by Health Science Center faculty, meaning that these instructors have PhDs in physiology and anatomy. So the instructors who teach you physiology and anatomy also teach the med school, also teach the dental school. So it's a very high level anatomy and physiology. The anatomy lab is a cadaver lab. Even during times of COVID, students still come to the lab and are able to practice in the lab. So this is the first semester: physiology, anatomy, an introduction to professional nursing, where you learn about some ethics and legal things, and then also the health assessment theory and lab. Then we move into the second semester, and it's Foundations of Nursing Practice Theory, Foundations of Nursing Practice Practicum, a lab, pharm, and patho, okay? So once again, the pharm and patho are HLSC courses taught by individuals who have PhDs in pharmacology and pathophysiology, and they also teach the med school and the dental school and allied health school. So it's, once again, it's very high level. Foundations, this is your first experience in the hospital, okay? So the practicum is the clinical component, so where 2 days a week, you'll be in the hospital between 8 and 10 hours taking care of patients. In Foundations theory here, you'll be learning about oxygenation, sepsis, and those types of diseases and nursing processes, and then you apply them in the clinical setting. And then we also have the Foundations lab / simulation. So in lab, you practice your skills: how to put in a Foley catheter, how to put in a nasogastric tube, how to check a pulse. And then we also have what's called simulation lab, and we have human patient simulators, which we can make do whatever we want. They breathe, they talk, their eyes blink, their heart beats, and you can do an assessment on it. And we can make it have chest pain, we can make it have a bleed in its head, and the vital signs will change accordingly, and then you have to react appropriately. And if you don't, then the patient will not do quite as well. So we have all these wonderful things in technology to help you learn to become a better nurse. Then we move to the junior year, the junior 1 semester, 15 hours. And here you have 2 practicum courses. You have adult health and you have mental health, okay? You only end practicum for half the semester. So adult health practicum, half the class would be in practicum and the other half would be in mental health practicum. After 6 weeks, you switch, okay? So theory lasts the whole semester. So every Monday afternoon from 1 to 4, you would be in mental health theory for the whole semester. Every Tuesday morning from 8 to 12, you would be in adult health theory for the whole semester. And then half the class would be in adult health practicum / clinical for the first 6 weeks, and half would be in mental health practicum, clinical. And then at 6 weeks, you switch. Okay, so theory goes the whole semester, but practicum only lasts 6 weeks, or half the semester. Okay, and then you also have statistics this semester, that BIOS 3115 course. Then the next semester, you get into the Junior 2 semester. It's a little more specialized with child health and women's health nursing. You also have a research course and a genetics course. So if you like working with peds, this is going to be the semester for you. If you like birth and babies or working with women's health, once again, this is going to be the semester for you. And that's called the Junior 2 semester. Then we get into the senior semester, and we have critical care theory, practicum, simulation lab, populations theory, practicum, and then you have to have a third humanities. So if you look at the top here, for the prerequisite courses, you needed 6 hours of humanities right here, okay? If you have 9 hours when you come in, then you're good to go, okay? If you don't have 9 hours of humanities, then by this senior 1 semester, you have to take that third humanity. And that third humanity can be taken at Delgado, LSU, anywhere. It can be taken online. We don't offer it here at the School of Nursing. So if you don't have that third humanities, you're going to have to take it somewhere else, okay? But if you come in with 9 hours of humanities, you are good to go. We're going to pull those 9 hours, and there's nothing else you have to do. The population course here is your community health course. And this is where you're out in the community. Maybe you work in health fairs. You're doing hospice care, home health care. You're going to schools and teaching kids how to brush their teeth and be safe. So it's very community oriented. And then the critical care course, that requires you to pretty much know everything you've learned in nursing up to this point. Your anatomy, your physiology, your pharm, your patho. Critical care nursing is very tough in that the patients have more than one thing wrong with them. When you're in foundations at the beginning, maybe the patient's only got diabetes. And then maybe when you go to adult health in Junior 1 semester, they have diabetes and maybe with a little bit of some heart issues. But in critical care, they're going to have heart failure and respiratory failure, and they're going to be in kidney failure, and they're going to be on dialysis, and they're going to be diabetic, and they're going to be on a balloon pump, keeping their heart beating. So there's lots of things going on with the critical care patient, okay? And then in the last semester, the light is here, you're about to graduate, we have this perspectives in professional nursing course, where we kind of wrap things up and talk about legal, ethical things, nursing as a profession, and what's expected of you. We have a gerontology course, and then we also have a nursing management theory and practicum course. So once again, because you're getting your BSN, we talk a lot about management. Many of our nurses become charge nurses when they graduate, and then also become nurse leaders at their institutions. So we're excited about this course. The practicum course right here is a little different than other practicums. When you're in critical care practicum, you're with maybe 7, 8 other classmates and an instructor. And you go into the hospital, you know, work together, you each have a patient, you work with the nurse, you work with the instructor, and you care for that patient. And this last semester, when you're in management practicum, it's called a preceptorship, okay? So we pair you up with a nurse in the community. So maybe your interest is ICU nursing. You really like ICU nursing. We're gonna pair you up with an ICU nurse, and you work one-on-one with that nurse. There is no instructor there. There are no other classmates there. You work in that nurse's shift, and you're really learning what it's like to be a nurse. Okay, you're working one-on-one. You're doing as much as you can. You learn how to organize yourself, time manage yourself under the direction of that nurse. So it's a good way to learn about the hospital and what it's like to be a true nurse, working those 8 to 12-hour shifts. So we pair you up with a nurse based on what you want to do. And that's how it goes. If you like women's health, we're going to pair you up with a labor and delivery nurse, and you're going to work that nurse's shift. And with that being said, you have 120 hours and you're able to graduate, okay, with your BSN. You walk across that stage and you have your diploma, you have that Bachelor's of Science in Nursing. The next step is to take the NCLEX, the National Council Licensure Examination. The NCLEX is the standard exam that all nursing students must take in order to practice as a registered nurse, okay? NCLEX is a very difficult exam, okay? It's high level, it's tough, okay? National average pass rates are about 86%. Here at the School of Nursing, our NCLEX first time pass rate is 98%. So if you get through our curriculum and you do what we're asking you to do, 98% of the time, students pass the NCLEX, which is really good, okay? So just know that. Our students go on to do great things when they graduate. They work with other hospitals and their leaders and do lots with policy and healthcare and things like that. So it's really, really exciting when they go out into the workforce and do great things. Our students are also involved in Student Government Association, Student Nurses Association. So there's many things you can do to also cultivate your leadership skills here at the School of Nursing. I would definitely encourage you to get involved with Student Government Association, Student Nurses Association. We have a Men in Nursing Club, a Diversity, Equity, and Inclusion Club. So lots of different things you can get involved in here at the School of Nursing. And with that being said, I'd like to thank you for listening to this webinar. If you have any questions whatsoever, feel free to reach out to me. Once again, you know, if you're on the nursing homepage, prospective students, academic programs, traditional BSN, you have my contact information right there. Reach out to me, let me know how I can help you get into the School of Nursing, and I look forward to working with you in the near future. So if you have any questions, reach out to me. If not, good luck. And please, we'd love to have you here at the School of Nursing. We need more nurses. And you can definitely come here and we can help you grow as a leader, become more self-aware, and do great things when you graduate. So with that being said, thank you for attending, and I look forward to meeting you in the future.